Next up, I'm pleased to introduce Dwight Turner. So Dwight is, 1 second. Dwight Turner is the meeting ambassador for VIA Benefits. So thanks for being here, Dwight, and it's all yours.
Okay, more than happy to be here. Can I get start video access?
Let's see. There you go.
Okay. Hello, my name is Dwight Turner, meeting ambassador with VIA Benefits. Throughout the years, I've had the pleasure of actually maintaining the VIA Benefits booth, and I've had the likes to meet a lot of you. I recall meeting Ish. I recall interacting with your retirees, and I have the privilege of presenting this information to you today. What we're going to talk about is exactly a refresher, more like, of who is VIA Benefits. We'll give you a refresher in reference to Medicare plan types, the 3 phases of working with VIA Benefits: prepare, review, and enroll. I like to call them the pre-phases. We'll talk about the HRA, health reimbursement arrangement. And if you have questions, we'll have a little time to answer some questions. Just as a reminder, you can always go to the my.viabenefits.com/Acera website, and you can always review the different presentations that are out online. Who is VIA Benefits? We are the first and largest private Medicare company. We coordinate services with CMS, Centers for Medicare and Medicaid Services, and we work with over 120 insurance providers across the country, local, regional, and national. We've enrolled over 2.1 million retirees from hundreds of employers. Happy to say that Acera is part of our family. We're going into our 16th annual enrollment season. So what happens when you call VIA Benefits? You're going to work with what we call licensed benefit advisors. These licensed benefit advisors, they want to do 2 things. They want to help you make an informed, confident decision when it comes to your health care or navigating the channels of Medicare. And they also want to help you find the most robust coverage in the most cost-effective manner when it comes to your health care needs. And that's what the licensed benefit advisors are there for. Now, would you agree with me that no one listening on this call has the same set of needs when it comes to their health care? We all take different medications. We all have different chronic conditions. And a few of us may actually be healthy. And that is the beauty in working with VIA Benefits. We analyze the individual situation and match the plans accordingly. Keep in mind that when you go over to the individual Medicare market, it is individual coverage. It's not family coverage, and it's not group coverage. It is individual coverage. Our call centers are open 13 hours a day, Monday through Friday, 5 a.m. to 6 p.m. Pacific Standard Time. You have a dedicated Acera toll-free number, 1-888-427-8730. And for those that are internet savvy, we highly encourage you to visit the website. It's 24/7, my.viabenefits.com/Acera. Just a little bit of information. We are in our annual open enrollment period, which goes on from October 15th through December 7th of every year, meaning we're pretty busy. So you can expect, if you're calling on a Monday or Tuesday, there may be some significant hold times. My suggestion is, if you give us a call, if you're going to call us not in the peak times, call it in the afternoons. Wednesday, Thursdays, and Fridays are good times to call. Just want to give you a little heads up in the event that you wanted to give us a call, and you won't wait as long if you call during those hours. Medicare plan types. When it comes to Medicare supplemental coverage, there are 3 different plan types. You have Medigap plans plus standalone prescription drug coverage plans to make you complete. With the Medigap plan, this is where Medicare pays 80% and your Medigap plan fills in the gaps. Depending on the benefits you select, you pay 20%. With that, to make you complete, you have the standalone prescription drug plan. Medigap plans do not come with prescription drug plans. You have to purchase them separately to make you whole. So between the Medigap plan plus the standalone prescription plan, that creates one path when it comes to Medicare plan types. The other path would be under Part C of Medicare, and this is your Medicare Advantage plans. This is where you get your bundled services. Everything's included. So just to distinguish, if you go with a Medicare Advantage plan, you're going to have one card. If you go with a Medigap plan plus standalone prescription drug coverage, you're going to have three cards. You're going to have your red, white, and blue Medicare card. You're going to have your Medigap card, and you're going to have your standalone prescription drug card. So that's just two paths, but there are many plan choices under those two paths. Now, if you're looking at the insurers, you see companies such as AARP, United Healthcare, Aetna, Blue Cross Blue Shield, Cigna, Humana, Express Scripts, Silver Scripts, and WellPoint. I think it's pretty safe to say these are some of the household names in the insurance business. And what I want you to know is that these insurance companies are in a major competition for your business. There are 10,000 baby boomers aging into Medicare a day, 70 million Medicare eligible lives. Insurance is all about spreading risk. Would you agree? There is not an employer-sponsored group plan that can compete with the individual Medicare market. They simply do not have the lives. So we're spreading risk among 10,000 baby boomers a day, 70 million Medicare eligibles. You could take some of the largest employer companies. They can't spread risk like we can. So what does that do? That drives the premium cost down and you get more bang for your buck. This is the reason forward-thinking companies are moving this way, because it provides flexibility for the retiree. It provides options, more options for the retiree, and you're gaining a support system unlike any other. It also helps the ASIRA to sustain the benefit. One thing that I want to make absolutely clear to you is that your original Medicare, Part A and Part B, does not go anywhere. You will always have your original Medicare Part A and Part B, and you'll always pay that monthly Part B premium. But once you go over to the individual Medicare market, you no longer have employer-sponsored group coverage. It's going to be replaced. It's going to be replaced with either a Medigap plan plus standalone prescription drug coverage, or a Medicare Advantage plan, which includes your prescription drug coverage. From time to time, I'll get people that would ask me this question: well, Dwight, I have Medicare. Why would I need supplemental coverage? Why would I need to purchase additional coverage? And my answer to them is Medicare has what we call financial exposures. These are high dollar deductibles that may have to be satisfied more than once a year, high dollar copays. And the Medicare supplemental plans, such as the Medigap, as well as the Medicare Advantage plans, they are designed to protect you in the event that you're exposed to those high dollar copays, to those high dollar deductibles. So that is the reason you want supplemental coverage. You also have the option with a Medicare Advantage plan of purchasing hospital indemnity plan, which will also help you in the event that you're exposed to some of the financial exposures of original Medicare. Next, we're going to take a deeper dive and we're going to look at the plan types in detail. We'll start with the Medicare Advantage plan. With the Medicare Advantage plan, this is where CMS, Centers for Medicare and Medicaid Services, they subsidize private insurance companies for administering plans on their behalf. Private insurance companies, in turn, they pass the savings along to you Medicare eligibles in the form of low to no monthly premium. This is where you'll find your HMOs, health maintenance organizations, limited networks. With an HMO, you have to stay in network to have coverage. You also have the option of PPOs, preferred provider organizations, which will allow you to go outside of the network. But by going outside of the network, you're going to have a higher cost share in most cases. Medicare Advantage plans are providing optional benefits, and we'll go over some of the optional benefits that Medicare Advantage plans provide in just a couple of more slides. But one thing I'd like to point out is that Medicare Advantage plans also focus on wellness and preventative care. A lot of your Medicare Advantage plans include gym memberships, $0 preventative services. And the intent behind that is, we realize is that if you're exercising, if we're giving you $0 preventative care services, we could potentially prevent a catastrophic incident from happening upfront versus someone not exercising, not taking care of themselves, not following up with their preventative care services, and experiencing a catastrophic incident such as a heart attack or stroke. So that is the reason why you have the wellness, you have the preventative care services, is to help prevent the catastrophic incidents from happening. I'd like to point out 4 characteristics of a Medicare Advantage plan. One is you have zero to no premium, low to no premium. You pay for the services as you utilize them, whether that's a doctor copay, specialist copay, ambulance, you pay for the services as you utilize them. 2, all Medicare Advantage plans are network-based, meaning if you're going to optimize the benefit, you're going to stay in network. 3, all Medicare Advantage plans have what we call an annual out-of-pocket max. CMS, Centers for Medicare and Medicaid Services, rules and regulations state that the most you will pay in a given year in network is $7,500, out of network $11,500. But what I can tell you is relax. Those annual out-of-pocket max vary by plan. This is good information to look up. This is good information to ask your licensed benefit advisor. I've seen plans as low, where the annual out-of-pocket max is as low as $3,800. I've seen some $4,000 plans, $6,700. Some of them do charge the max for in-network, $7,500. So this is a great question to ask your licensed benefit advisor if you're interested in a Medicare Advantage plan. If you're internet savvy, you can look that information up. The 4th characteristic is Medicare Advantage plans are always what we call guaranteed issue. You're never subject to medical underwriting. Pre-existing conditions will not be factored in with Medicare Advantage plans. Medical underwriting is a series of questions in which the insurance companies will ask you. Based on how you answer those questions, they have the right to raise your premium, and in some cases, they could actually deny you. You are free to change your Medicare Advantage plans from October 15th through December 7th, as well as your standalone prescription drug plans. This is the annual enrollment period, which we're in now, and this is when you can make changes to your Medicare Advantage plan or your standalone prescription drug plan. Now we're going to take a look at the bookend opposite, the Medigap plans. I'd like to share 3 characteristics of a Medigap plan with you. One is you're going to pay a higher premium, but on the back end, you're going to have little to no out-of-pocket expenses. 2, unlike the Medicare Advantage plans, Medigap plans do not have a network. You're free to see any doctor, hospital, medical facility in the entire United States, as long as they accept Medicare. And if you're a new patient, you have to make sure that they're accepting new patients. 3, if you're outside of a special election period, you may be subject to medical underwriting, and pre-existing conditions can be factored in with a Medigap plan. But I do have a bit of good news for you. If you live in the state of California, California has a special rule known as the California birthday rule. Every year around your birthday, it opens up a window to where if you want to enroll in a Medigap plan, you can without being subject to medical underwriting and without pre-existing conditions being an issue. So you have a rule that you can take advantage of every year around your birthday, known as the California birthday rule. Now, in 47 states, there are 10 plans, 10 lettered plans, A, B, D, G, K, L, M, and N. Notice plan C and F are separated. And that is because CMS, Centers for Medicare and Medicaid Services, they have implemented a new rule. They say anyone that is Medicare eligible before January 1st, 2020 can enroll in Plan C and F. A Plan F is the most robust coverage that you can get. Notice it gives you 100% coverage across the board, with the exception of foreign travel emergency, which is covered at 80%. If you're Medicare eligible after January 1st, 2020, the most robust coverage you can get is the Plan G, which gives you 100% coverage across the board, with the exception of foreign travel, which is at 80%. And you have to satisfy your Part B deductible, which for 2021 is $203. And I believe the suggested Part B deductible for 2022 is going to be $217. But that is the only difference between the Plan F and the Plan G. Remember, I said earlier that the licensed benefit advisors want to help you find the most cost-effective coverage, the most comprehensive coverage in the most cost-effective manner. Well, in this situation, you see the Plan F, you're going to pay a higher dollar amount in monthly premium. But what we've noticed is with the Plan G, you'll pay a lower premium, and sometimes you satisfying that Part B deductible is the most cost-effective route to go. So what we've discovered in a lot of cases, the most cost-effective plan overall when it comes to the Medigap plans is the Plan G based on price. So if you're interested, talk to the licensed benefit advisor. They can analyze and let you know exactly whether that's the case in your area. When it comes to prescription drugs, it is a tiered system. Most of you are familiar with tiered systems when it comes to your prescription drugs. Your lowest tier will be your tier 1, which is going to be your preferred generics. Tier 2 would be your non-preferred generics. Tier 3 would be your preferred brand. Tier 4 would be your non-preferred brand. And tier 5 would be your specialty drugs. How are those tiers determined? Every prescription drug provider has what they call a formulary, which is just a fancy word for prescription drug list. Medications that are preferred, be it generic or brand, cost less than the non-preferred meds, be it generic or brand. The highest tier would be your specialty medications. These are your biosynthetic injectables, high dollar medications. Some of them do come in pill form. And if you're on this type of medication, believe me, you got a lot of nurse practitioners calling you. They're making sure you're following your regimen. Some of these medications are actually life-sustaining. So if you're on that type of medication, you know. For 2022, the prescription drug levels. This first level is your deductible. It can be anywhere from $0 to $408 or $80. Once you satisfy this deductible, you move to the initial coverage level. During the initial coverage level, you pay whatever the plan design copays is, and the insurance pays the rest until the actual cost of medication between what you pay and what the plan pays equates to $4,330. Once you hit that mark, you move over into the next level of coverage known as the coverage gap, or more commonly known as the donut hole. Once you're in the donut hole or the coverage gap, you pay 25% across the board, be it brand or generic. And you also receive help when you hit this $4,430 mark. That help comes in the form of manufacturer discounts, which counts 70% towards your true out-of-pocket costs. So it's running a tally and it's tracking what all goes towards your true out-of-pocket costs. 25% of the cost for brand and generics, 70% of the manufacturer discounts, and 5% of what the insurance pays. Once that totals up to $7,050, you move into the fourth and final level of coverage, which is known as the catastrophic level. And it's estimated that only 4% of the Medicare eligible population actually hit the catastrophic level of coverage. This is where you pay $3.95 for generics, $9.85 for brand, 5%, which is ever greater. Keep in mind, this is based on the calendar year. So every January, it resets. The good thing is that most of you will stay in an initial coverage period. If you have questions, our licensed benefit advisors can analyze the plans based on your medications and let you know exactly where you fall. Working with VIA benefits, what I like to call the pre-phases, 3 phases: prepare, review, and enroll. Most of you have been through the prepare section. You have plans. So we're going to concentrate on reviewing information if you're looking to make a change. Keep in mind, if you're happy with the plans that you're in, you don't have to do anything. They automatically renew. If you're looking to make change, we have all the tools online for you to help yourself. We have a shop and compare feature, which allows you to sort the like plans, line them up side by side, and look at the different costs, how much you're paying in monthly premium, how much the plan costs you in total for the year. It breaks down to prescription drug costs for the year and on a monthly basis. So this helps you make that informed decision. This is just one tool. We also have the optional benefits where you can, under your Medicare Advantage plans, you can click on the optional benefits button, and it's going to let you know what each plans provide in the form of optional benefits. And they range from plan to plan. Some optional benefits that different Medicare Advantage plans include are dental, vision, meal plans, gym memberships, hearing, telehealth services, chiropractic services, transportations to and from doctor's appointment, and Part B give back. That is just some of the optional benefits that are available. I want to take a little time to emphasize this telehealth feature. Remember, it used to be such a big issue. I'm out of network. I'm out of town. I can't see a doctor. My HMO is not going to cover it. Well, if you have that telehealth service, you can give them a call and you can do your appointment over the line, thus eliminating that issue. And that's just one of the optional benefits that the Medicare Advantage plans have. The prescription drug check. This is where you enter your names of your medications, the dosage, as well as the frequency, and the system automatically lets you know what plans cover your meds in the most cost-effective manner. And once again, sometimes you may have problems entering your frequency and dosages, especially with liquids and gels. If that's the case, give us a call. Our technology has been updated to where now, every year, if you have that information updated, the system can inform you what is the more cost-effective plan based on the medications you're on. So that's another tool that you have in your pocket to use. The Help Me Choose function. This is where you can line the like plans up or decide the route you want to go, which plan type you want to go, whether it's a Medigap plan with standalone prescription drug coverage or a Medicare Advantage plan. Now, we do realize that some of you have been with your doctors for years, and that could be the number one or the most important thing. With this Help Me Choose function, you can enter your doctor's information. It will let you know what Medicare Advantage plans your doctor accepts if you're looking to make a change. So if you're thinking about changing plans, you have the option to go online or have that conversation with your benefit advisor. update your prescription drug information, complete the needs analysis, choose a plan type, and we're here to help. The quickest way to enroll is online. Over 93% of our plans allow you to enroll online, or you can go to the actual website. Keep in mind, you have coverage. The annual enrollment period is from October 15th through December 7th for a January 1st, 2020 date. So what are you gaining by working with VIA Benefits? Help and a support system unlike any other, access to the shop and compare feature, and all the technology tools that we use. You also have your HRA, which allows you to be reimbursed for all your premiums except Part B and long-term care. And you can be reimbursed for medical and prescription drug out-of-pocket expenses. It's simple to make your premium pay. You pay your premium to your provider, permit the receipt, VIA Benefits reimburses you. You can set up online and automate, and you can do that as well on a mobile app. If you have any questions, you can contact your benefit advisor and they'll get that information to you. You can also set up automatic reimbursement, which allows you to simplify by setting up an EFT from the account of your choice, paying your premiums. The insurance carrier will send the payment on your behalf, taking you out of the loop of having to submit paper, and we reimburse you from there. Just keep in mind, to have your HRA, you must enroll in a medical or prescription drug plan through VIA Benefits, and you must remain enrolled in a medical or prescription drug plan through VIA Benefits. So if we have any questions at this time, we'll go ahead and answer them.
All right, excellent. Thanks so much, Dwight. We do have some questions. The first question is, if I enroll through health insurance through VIA Benefits and don't like it, will I be able to return to either Kaiser or United Health through Acera? Is it okay if I take that?
Yes.
Okay, so open enrollment is your annual opportunity to change plans to whatever you want to. Now, outside of open enrollment, and open enrollment is the month of November for Acera, but Dwight was just talking about how the VIA Benefits open enrollment is a little bit extended from just November. And so the open enrollment period is detailed in the retiree enrollment guide that we sent you in the mail. Now, outside of open enrollment, there are various qualifying events like relocating, getting married, getting divorced, a death in the family, etc. Those are all listed out on our website. And if you have one of those qualifying events, then that would be another opportunity to change plans. Regarding who's eligible for VIA Benefits, if you're Medicare eligible, and you're talking about switching between Kaiser and VIA Benefits, then you can live anywhere in the country to do that. Now, if you're not Medicare eligible, you have to live outside our group plan areas in order to enroll in a plan through VIA Benefits. Okay. And so we do have another question. If you are trying to enroll in one of those individual Kaiser plans, it's not in VIA Benefits, but what VIA Benefits does is opens an HRA for those people, and it's one of those Kaiser plans outside of Northern California. How do they, what's the process for that? I believe that you contact Kaiser directly, but then how do you get the HRA set up with VIA Benefits?
You have to call. You want to answer that, Ish?
Yeah, I'll take it. So yeah, so basically, if a member relocates outside of California and they relocate to somewhere where there is a Kaiser, because Kaiser is available in other states, Hawaii, Colorado, Georgia, Washington, they're in other states, Oregon. So if they relocate into the service area of a Kaiser that's in another state, they would enroll directly with that Kaiser for an individual plan. Once they've been enrolled by Kaiser into the individual Kaiser plan in that state, then they'd want to contact VIA Benefits to opt in for their HRA account to get reimbursed for their premiums and out-of-pocket copays. Okay, so they would be responsible for enrolling directly with that out of the area Kaiser. Okay, once that enrollment is complete, then they contact VIA Benefits to opt in so that they can begin getting their reimbursements accordingly through the HRA account.
Excellent. Thank you, Ish. So next question. If you want to keep your Medicare plan the same, Do you need to update through open enrollment with VIA benefits each year?
No, it automatically renews. If you're not looking to make any changes, you don't have to do anything. Just continue to pay your monthly premium, and it will automatically renew.
Great. Does TRICARE for life coverage fall in the Medigap category?
We do coordinate benefits with TRICARE for Life. If you are TRICARE for Life and you're looking to make changes, you want to give us a call and talk to a licensed benefit advisor, and they'll go over the various options and working with TRICARE for Life and the plans that really accommodate TRICARE for Life with you.
Okay, and so we're running a little behind, but I think we have time for maybe a few more questions. One question is, so there's two questions around the HRA. Does the money disappear at the end of the year, and where does the money come from again? So yes, you can't roll over HRA amounts from year to year. And the money comes from the Supplemental Retiree Benefits Reserve, also known as the SRBR, which is the reserve fund that's set aside to help SARA retirees pay for various healthcare costs. Now, there's certain eligibility requirements to be eligible for that money that goes into the HRA, and it's that the money is called the monthly medical allowance. So it's the monthly medical allowance that SARA sends over to the HRA at VIA Benefits to help cover the cost of being enrolled in one of those plans through VIA Benefits. And there's a question, why doesn't the HRA money roll over to the next year? Well, that's just kind of how the Board of Retirement has set up that that benefit to work. Do you have anything you want to add to that, Ish?
Sorry, trying to keep that mute to unmute. Yeah, so it's a set amount that's set annually. So from watching all these years that we've had the HRA set up, very, very few retirees ever use all the funds that are in there. Okay, and so it's not like we can, when the year ends, then that portion expires. You still have until March 31st of the following year to submit for any claim items that you may have still not sent in to VIA Benefits to get reimbursed for from that prior year. So although it does reset come New Year's Day to back to zero, and you start a new year, if you still had a balance, you still have till March 31st to submit for any claims that you may have not submitted for to utilize those funds. Okay.
Great.
There's strict guidelines regarding the HRA accounts and so forth, and we want to make sure we stay in line, not just with VIA Benefits, but also with the federal government, because we don't want to have any penalties imposed on us and anything like that.
And do you have to notify Medicare when you change plans?
No, that all of that is done on the back end. We have to submit all the information to Medicare in the event of a change of plan. When you enroll with a different insurance carrier, they take care of that on the back end.
Okay. And we're kind of over time here, and I know you have to run, Dwight. So all of the rest of the questions that are typed into the Q&A, we will go ahead and get answers to those. And we'll type all those answers out, and we will post those to the health fair page later today. So don't worry, we'll get all of your VIA Benefits questions answered. Okay, so I want to thank you so much, Dwight, for that extremely educational deep dive into Medicare and VIA Benefits. So yeah, thanks for being here.
Thank you guys for having us.
Sure.
Bye, Ish.
And if you can go ahead and stop your screen share, that would be awesome.